This episode is about a health topic, and we'll be naming some body parts and talk about functions. And I wanted to give you this heads up so that you won't play it around little ears or somewhere it might be embarrassing for you. So pop your earbuds in. It is a needed discussion and it's helpful information. I hope you enjoy it. I hope you find it to be quite helpful. Just wanted to offer this little piece of caution.
Close your eyes and count to 10. Take this moment to breathe
Hi, everyone. Welcome to The Bearing Life. We have a really interesting topic this morning. A few months ago, a friend of mine got in touch with me to tell me about an issue she was having with her body. And I knew nothing about this issue, and she told me about it. And then another friend contacted me, and she's on with me today, and told me a little more information about it. And so we decided we needed to do an episode on pelvic floor dysfunction. Today, I have a friend of mine with me, Candice Unger. She's the Director of Communications and Connections at her church. She has been married to her husband, Mike, for how many years have y'all been married?
16.
16 years. Wow. Congratulations. They have two fur babies, Hattie and Huxley. She's a native Texan, and she recently got to come back from a few years in Canada. So I think she's really happy to be home in Texas. And then we also have her physical therapist, Katlyn Nasseri. She's a PT, DPT, WCS. She's board certified in pelvic health physical therapist, and she's based in the Dallas-Fort Worth area. She's been a physical therapist for 5 years, and the last 3 years she specialized in pelvic health, which again, Kat, I knew nothing about until a few months ago. So Kat treats women, men, and children with a variety of pelvic floor dysfunctions. And so I wanted to bring both of them on. I want Candice to share a little bit of her story because I was really interested. I've known her for several years. We've never discussed this because, people don't normally discuss this. And I said, let's do it. She called and said, would you be willing to do this topic? And I said, yes, I think we should. And then Kat is her physical therapist. So Candice, if you would, will you share a little bit of your story and how you came to know Kat? And then I'll let you bring Kat into our conversation.
Sure. Thanks, Julie, for having us on. Like you, I had never heard of this either a few months ago, but I will kind of go back to the beginning. So Mike and I have been married for 16 years, and about 10 years ago, I began experiencing pain during sexual intercourse, and it came out of nowhere. I'd never had that kind of pain before. I didn't know why. So I went to my doctor, and he was like, everything's fine. But the pain continued, and it got worse. And so there was some details about maybe there's a surgery that could potentially help. So I had that surgery. It's called a perineoplasty. So to get kind of detailed about
tell me about, or do you want to?
I will, because one of the reasons I want to tell you about this is because they don't really do this surgery anymore because it doesn't do any good, which I just found out too. So I had this perineoplasty, and so there's small tears that can happen over time just due to age and Kat, you can stop me if I'm doing something wrong, but telling people wrong, but age, childbirth, trauma, whatever. So there was an issue. Maybe I had a fissure or a skin lesion. So they were going to kind of remove that out and then put the skin back over so that it would heal kind of newer skin. So after that surgery, I healed and everything, but I still had the pain. And it actually got worse.
Can I ask you a question? Just for clarity, please. Because one of the reasons why when you told me about this, I wanted to have the conversation is I thought, if I didn't know about it and you didn't know about it until you're in the middle of it, and I now know two other people who I'm close to who I found out are going through therapy for this, there must be a lot. So when you talk about pain
Yes.
Just in case somebody's having some weird pain and they're like, I don't know what it is. And again, I'm not a medical doctor. You're not a medical doctor. Kat is medically certified as a physical therapist. We're having a conversation about a variety of things regarding this. The surgery, I'm assuming that was external.
Yes.
Okay. So your pain was your pain internal, external, both?
Yeah. That's a good question. More than likely, it was an external, it is the entry point into my vaginal area.
Okay.
But it was the skin around that. We are kind of, again, this is part of therapy, is figuring out where the parts are.
Okay.
I will say my pain was like razors. That's what the pain felt like.
Okay.
And it was fine. What happens is I could put a tampon in and it would be okay.
Okay.
Because we have these little grooves in our entry into the vagina that it's like a shelf. And my shelf somehow is dysfunctional.
Okay.
And so the entry in was causing so much pain. But, as you know, I'm going to get graphic here. The penis stays in and it's always touching that place.
Okay. That makes sense.
The pain was painful during the whole time sexual intercourse was happening. So as you can well imagine, it does mess with your head. I mean,
sure.
Is it going to hurt every time? And then it does. And then years go by. I'm talking 5 years now, 6, 7, 8, 9. Now we're on year 10.
Oh my word.
And, I'm just so grateful to my husband because he's been amazing. Like, he's so caring and supportive and loving. And, I don't know, we've survived this issue. And he's been patient. And anyway, long story short, I moved back here from Canada, went to my doctor, a new doctor, and I just flew it by her. Hey, by the way, I've been having painful sexual intercourse for 10 years. And she was like, well, that shouldn't be happening. And I'm like, yeah, I know, but this is my lot in life. This is what I've said to myself, because I've been to so many doctors and they all said I was fine. So she said, let's send you to a pelvic floor specialist or a pelvic specialist. And so I went to her, and literally I was with this doctor for like less than 5 minutes. And she was like, I'm about 95% sure what you have.
Oh my word.
And I was like, what?
After all those years of trying to find out?
Yes.
My goodness.
And I will tell you, and Kat can confirm this, like statistically, women, men, whoever has pelvic floor dysfunction, they don't usually find out anywhere from 6 to 8 years into being in pain. They don't find out about they can get help, that they even have a diagnosis of this.
Mm-hmm. Okay, can I say right here, I am so grateful that you called me and said, hey, let me tell you about this. You need to do an episode on it, because my ignorance is real, because I was going to do more research on it. I thought, no, I want to have this conversation not knowing anything really. And that you just said that people can go through, and the majority of people go through years of discomfort and pain or whatever it is, and they have no idea. So for anybody listening, share this, because I know maybe you think, oh, I don't have that issue, so I don't need to listen, but maybe somebody does. Okay,
yeah.
I'm sorry.
I'm sure Kat will tell you more symptoms that pelvic floor dysfunction has, because mine is my pain.
Right.
But other people have different, even like bladder control and the other end, the back end problems happen too. Anyway, I'll finish my story. So essentially, when she told me that I had pelvic floor dysfunction, she was like, we can help you. And there's physical therapists that specialize in this. And she was like, it's very rare. These specialists are amazing, Candice. And there's some right here in our area. And so I got sent and I made an appointment, and thankfully I got this amazing PT named Kat, who, nothing's coincidence. I firmly believe that God connected us in some form and fashion. So of course I went to this appointment knowing nothing about what this kind of physical therapy was going to be. And so Kat spent at least the first hour with me, literally hour, talking about physical floor dysfunction, answering all my questions, literally showing me like a body part of what our pelvic floor looks like. I mean, it's kind of like a little hammock that holds all of our body parts. And, men have this too. Men have pelvic floor as well. And so just understanding and being more educated about this, and then just tying in all some other issues that I've had in my life, like some lower back pain, hip pain, like all that stuff is probably all together in there. And then how we hold stress in our bodies. Sometimes we hold it in our shoulder or back. Well, I think I might hold some stress in my pelvic floor. And so all of these things combined. But the good news is I am getting amazing physical therapy, and it's an interesting type of therapy. There's some internal work that is done. There's stretches that I do at home, all sorts of different things that can be done. And I'll let Kat kind of talk more about that because she's more specific about that than I am. But I am just so grateful to, number one, have been diagnosed. To number two, that I'm receiving help, and I pray that I get better fully. But my number three that I wanted to say, the most important, was as soon as I found out about this, I wanted to tell everyone about it. And it's a very intimate thing to talk about. And especially in circles I run in, it's sort of like, this isn't something you talk about. And I really wanted to make sure that people knew this existed and that there was help for people that have it.
Well, and I want to say, number one, kudos to your wonderful husband.
Yes.
For his care. And it sounds like for a very long time, very caring and open about it and supportive. And that's huge.
Yes, it is.
And I want to say thank you for your honesty and your authenticity and your willingness to not, sometimes when we have issues, you and I both walked through infertility. So we've been through all of that humiliation as well. And all of those things are so difficult to talk about. And as women, I feel like it's difficult to talk about. And I know men in general don't discuss things like this. So there can be some men in pain, and Kat can address it in a minute too. But yeah. I just want to say thank you. Thank you for calling me and saying, hey, you need to do this. And then when I said, okay, great, are you willing to come on? And you were like, yes. So there was no hesitation. And thank you. Everything you shared is great and helpful and well done. Thank you very much. So Kat, do you want to jump in and fill us in more on the physical therapy side of it?
Yeah, absolutely. And I also want to thank Candice for being so willing to share her story because, like she said, most of our patients that come in the door for pelvic floor dysfunctions of any variety, whether that be bowel, bladder, sexual dysfunction, even our pregnant and postpartum women, these are just things that we don't talk about or that unfortunately have been passed down to us. The information has been, oh, it's normal. Every woman goes through that. Every woman feels that. And I can only speak to my experience as a woman having been told that, or hearing, it's normal that you pee on yourself a little bit when you sneeze or whatever, or it's going to hurt the first time you have sex and then it's going to be great and just power through. You'll be fine. So I just want to say thank you to Candice for sharing this story because it is so important to get the information out there to other people experiencing any sort of symptoms that are so hard to talk about. And that's not only with friends and family, that's also with physicians, unfortunately, that people may not bring it up because they don't think anything can be done about it. They may not bring it up because they're ashamed by it. They may not bring it up because they are too nervous. They may not bring it up because they don't think anybody cares. I don't know. I think it can be any of the above or all. So thank you for sharing this. So I'm a pelvic floor PT, and this is, that's all I do all day, every day, 40 hours a week. And Candice has come in a couple months ago now, and with her pelvic floor dysfunction and her painful intercourse, the technical term for painful intercourse is dyspareunia, which just means it hurts when you have sex or when something penetrates. That can even mean, for other people, can mean a tampon or a speculum exam that you need to have to be able to get a pap smear. So dyspareunia, though, really we think about penetration and sex. So she came in and yes, she has, some signs and symptoms. That's why it takes such an extensive subjective history, because what I want to do is confirm what I think I already know whenever I do my exam, because it is very personal. It's a pelvic exam. It's no speculum and no stirrups, but it is an internal and external pelvic exam. And for women, of course, that includes the vaginal canal and the muscles inside our pelvis. So I want to have a good idea at least of what I'm going to find when I do that exam. So when Candice is telling me, this started 10 years ago, I had this surgery, it hurts initially, and then it stays and it just doesn't go away. I'm already thinking like, okay, I have some ideas about what I'm going to find when I see this. So like she said, a lot of people hold stress and tension in their pelvic floor. The whole other conversation we can have is about trauma and where we hold that. And it doesn't have to be sexual trauma. It can be of any sort that we tend to just internalize and hold that. And one of the really common places that we do that is within our pelvic floor muscles. So,
oh, wow. Okay. Yeah. That needs to be a future conversation we have about the effects of trauma. Oh my word. Had no idea. Okay.
Right. So I would love to be back. We can talk about that.
We'll do it.
So she comes in. And so what I'm trying to figure out, and whenever I do an exam and then whenever I find what we need to treat is, okay, are these muscles that should be resting at a pretty normal level? Are they resting at an elevated level where you're holding them kind of constantly and because it hurts or it used to hurt or you're afraid it's going to hurt? And then that's another part that can happen during sex as well, is that if you have a history of, it hurt the last 5 times that I had sex with my husband, I'm going to be in a really guarded and protected position. And that's going to include my pelvic floor muscles whenever we go to have sex that 6th time. So that doesn't help the situation and it can only propagate and make it worse. And then, she had, Candice had the perineoplasty, which, yes, it's not as ideally anyway, a common surgery that they'll perform for painful intercourse because, yes, she may have had a fissure or a tear of some sort, but what was causing that? Was that a hormone issue? Was it that the muscles actually were too tight and that was causing restriction in the skin and that's what was causing it to tear? And so that's
interesting.
Yeah. I don't know because I wasn't unfortunately there 10 years ago. But so now we at least have some providers, and we're still really too short, I think, in the world of pelvic health as far as providers in both medicine and physical therapy and every other aspect of this, and people who are knowledgeable and educated. But yeah, that used to be, an answer. It was like, well, maybe they just didn't know as much, or maybe they were just a provider that wasn't sure, or maybe it really was only that. And who knows, right? I can't say. But what we can say now is now you have all this scar tissue that's built up in the perineal area, right? Yes, you had a surgery to help heal that. And yes, you do have new skin growth, but you also have scar tissue growth. And
now, is that from the surgery?
Yeah. I mean, any surgery you're going to have scarring, right? I mean,
right. Okay.
Any sort of cut, you're going to have a scar that develops because of that. And that happens in every part of your body. And so you have to think through like, okay, if I had a knee surgery and they cut open my knee and they did something, right? Let's say they removed, filed down my meniscus, they removed out some extra tissue. I don't know. Then they stitch you back up, you're going to have a scar on your knee. And then somebody somewhere along the way, after you have that surgery, or likely before, is going to tell you, hey, you're going to have a scar. It's going to limit your knee motion. You're not going to be able to bend your knee as well so that you can go back and do squats like you used to do. You need to go see a physical therapist, or at the very least, you need to be aware of that and make sure that you're bending your knee a lot during your day. Unfortunately, women with pelvic floor dysfunction and after pelvic surgeries, a lot of times don't get that same information. And so don't know. And also it's not the same thing, right? You're constantly walking, bending over to pick stuff up, whatever. So your knee has to move anyway. We don't have that same sort of function with our pelvis. Yes, the muscles are always working, but they're not always moving and stretching and whatever. So then that becomes its own issue. And so that's kind of what we work through is, okay, so how do we get this scar tissue to move? Because scar tissue is irregular in the way that it lays down. A lot of tissue is really straight and pretty and in line. Scar tissue its job is to heal and to close you back, right? And to heal the wound that was there. So it'll lay down in kind of like a little bundle. And then what gets trapped in there, but nerves and vessels and all of that connective tissue can become now really short because of the scar tissue, and fascia that surrounds your muscles becomes short because of that. And so you just have this entire cascade of problems.
So then you have more pain, right?
Exactly.
I mean, I would assume, as I'm thinking about what you're talking about, what that scar tissue would feel like,
right.
That's just exacerbated the problem. I would think, right?
Which is what, right. Exactly. Which is what I can say, Candice, that was her experience, right? She said, well, now the pain's even worse. I'm not shocked, right? Because
wow,
now you have to deal with that as well. And so that's really where I come in, and my job is to figure out, number one, is that actually what's happening? And yes. And then two, how do we treat it? And it is definitely a very personal and very intimate treatment, as far as we're going to get really close really quick. And I feel like I warn all of my patients that day one, because the first thing I'm going to say is, hi, welcome. Do you know why you're here? They say, yes. My doctor sent me for this. Did the doctor tell you what to expect from me? The answer is almost always no. It's just that you can help me, because I think also the doctors don't want to have to tell people they don't know exactly what I'm going to do every single time, right? Because for everybody, it's different. I may not do a pelvic exam on the first day or whatever, right? There's lots of factors into that. But anyway, so they come in, they're like, I'm just here. Can you help? And I'm like, okay, yes. I'm going to explain a lot of stuff, but I'm also going to ask you some really personal questions. And I know I'm a stranger, but I talk about it all day, every day. So nothing is going to surprise me anymore. Honestly, I ask people, I'm like, I almost wish I could get surprised at this point. Like anytime I hear anything, I'm like, old news, heard that before.
But okay, wait, that's so comforting though. Like for people who are listening to know that, yes, for you, and trust me, I well remember a lot of the things that I had to go through with infertility discovery and exploration and all of that. And Candice did too. And thankfully, I knew a couple of people who had gone through some similar stuff, and they would laugh. They would go, okay. And they would start laughing. Oh, here's what you're going to go through. And I was like, what? I mean, it's horrifying. Yeah. So it would be nice, I would think, if someone's doctor who's going to refer them to you would at least gain the knowledge on their own to go, let me just prepare you. It's going to be very intimate, instead of just saying, okay, I know where you can go to be helped. And I'm sure there are doctors who do that. And if you're one of those doctors, I'm not bashing you. I'm just saying it would be probably really helpful to have a little better communication from the referring doctor before they see you, because then I would think that would make people tense up even more. Yeah. Well, right? Or no?
Yeah. I mean, it definitely can. And there definitely are some doctors who do try to explain a little bit of like, they're going to, and I think really they don't necessarily tell you what the exam is going to be or exactly all the questions I'm going to ask, but they're going to say they specialize in muscles that are in your pelvis, and they're going to be able to evaluate those and assess and get an idea of what's going on and then how to treat it. They just may not go into they just typically don't go into the nitty gritty of, okay, you're going to go to this girl. She's going to do an internal pelvic exam. She's going to ask you to be half naked on the table. And, they don't tell you all that. And honestly, to an extent, I'm not sure that I want them to, because for somebody who is extremely nervous and doesn't want to do that, possibly ever, I won't make them. There's other ways for me to glean information about your pelvis without doing an internal exam. It's just that, so I don't ever want anybody to be scared off and think, oh, well, if I go to physical therapy, she has to do a pelvic exam and it's going to be awful. Because it's, first of all, I think Candice can attest to it's actually not that bad.
No. And I was going to say, at 10-year point, you're desperate to get help.
Yes.
I mean, I would do anything at this point. And so I would say, probably a lot of your patients, I don't know, I would assume that if they're coming to you, they are so ready for help. And so it is odd and intimate as it is, it's still, I'd still do it over and over again. And I would assume others would be the same way. And Kat is so caring in the way she explains things.
That's awesome.
Yeah. So in a way, I think it's kind of good going in not knowing a whole lot.
Okay.
Because then you're getting all the right information from her, because some of these doctors don't even know.
Okay, well, that's a very good point. Okay, so, okay, doctors, don't worry about knowing about it. Know a little.
Well, they still need to know enough to send them.
At least enough to go, okay.
Yes.
Remember, some of this could be internal. I mean, even just that would be good.
Yeah, just know that there are muscles and that there can be a musculoskeletal problem happening, that someone is out there that can help them. There are practitioners who can do something about it. It doesn't have to just be medication. It doesn't have to just be surgery, or even worse, it doesn't have to be just live with it. That's my biggest issue, is that a lot of people are out there just living with it because they've been told. But unfortunately, pelvic floor physical therapy, we're pretty small. There's not a bunch of us anywhere in the country. So we can't tell every single physician that we're here, right? And so a lot of people don't even know that this is a job that I can even do. So, So that's,
and a minute ago, you said something, you named off a couple of different things. I think it was you, maybe Candice, but I think it was you, Kat. A couple of different things that I know I've heard as growing up through adult years and now getting further into way further into adulthood. And you hear all these things go around from whatever person or, but it's like, oh yeah, you're aging, that's just going to happen. Or, well, if you're over 40, well, yeah, you got to deal with that. I mean, and I think I don't know where it came from, and it doesn't really matter. I love it that you're saying no.
Yeah, right.
Life doesn't have to be that way. Physical things that are going on, they don't have to be that way.
Correct. Our favorite saying, just because it's common doesn't mean it's normal.
Okay, wait. Say that again. That really was good.
Yeah.
Say it again, please.
Yeah. Just because it's common doesn't mean it's normal. So just because it's common for women to have leakage of urine after they're pregnant and deliver a baby doesn't mean that's normal. That actually doesn't have to happen. Just because it's normal to have some pain during pregnancy, or pretty strong pain during pregnancy in your low back or in your hips, doesn't mean it's normal. Some of that is, yes, but it doesn't have to. There's certain levels that it's not normal. It's normal to maybe have a couple of days of constipation, but it's not normal to live your entire life having one bowel movement a week or whatever. I mean, it's not normal to have painful intercourse for a long time. And unfortunately, also, so many young women are told that it's going to hurt the first time, it's going to be uncomfortable, blah, 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 which is often true just because of some structural things, may be more uncomfortable. But then whenever it hurts afterwards, they're like, oh, you just need to drink a glass of wine. You're just too nervous. So just relax and then it'll be better and it'll stop hurting. It almost places the blame on the woman for having painful intercourse, which is unfortunately not true, right? Like, it's not her fault. It's not that she's just nervous or stressed. It's that there's likely something physically happening in her body that's making her have painful intercourse, and that makes that then continue to persist for possibly her entire sexual life, right? Which is really terrible.
Let me ask you, is there a way, like for maybe young adult women, they're not married or they're not having sex and they haven't had kids, and is there a way to tell just by the way your body feels, or maybe other things that don't involve sex or having children? Is there a way to tell if you are predisposed to having that stress burden in the pelvic area or no?
So to an extent, so one of the things that I always ask is, like, do you have pain whenever you insert a tampon or remove a tampon, right? Whenever we start having a cycle, if, after the first time, again, the first time of, I think anyway, in my history of using a tampon was rough, mostly nervous, mostly stressed, mostly like, what is happening to my body right now, right? And then, so that's one way, is like, has that been painful? Or whenever you do go to the gynecologist for your, annual exam, which, now this rules are changing on how often they're doing a pap smear, but when you have a speculum exam, does that hurt? Because it shouldn't. It may be uncomfortable, but it shouldn't hurt. It shouldn't be excruciating. It shouldn't be that you're in terrible pain all day after that. So those are a couple of the ways that I've often seen that. Unfortunately, as far as like without using it, right, without, inserting a tampon or a speculum, there's no way to know that it's going to hurt with insertion always. But I do find that people who have a ton of like restriction and tightness and are also really stressed, that maybe they hold a lot of their stress and they're noticing they're always like holding their butt together, or they're like squeezing their legs together and they're just really, really wound up. That is often one of the things that I'm like, well, that's not helping your cause, right? But I don't know that I can say that about every single person who is that way, right?
Okay, so, but that might be a good sign that you have a tendency to hold stress down there,
Mm-hmm.
right? Are those the two main ones that you maybe find yourself squeezing your legs together for no good reason?
Or like holding your butt together for no good reason, like just constantly just holding in that area. That's not great. I mean, for any part of your body, right? It's not great to, like, same thing as like holding your shoulders out close to your ears when you're stressed out. That's not great for the muscles in your shoulders and your neck. The same thing that happens in your pelvis, because those muscles do attach into your pelvis the same way with your abdomen. We as women who are always taught to hold your belly in, right? Don't let it poke out. That's not cute. That's another one, right? The muscle comes down, attaches to your pelvis, and then can feed into some already maybe predisposal towards a high tone pelvic floor or a restricted pelvic floor that then could potentially lead to painful intercourse. But unfortunately, until I see somebody, I don't know exactly what's happening, because the muscles are inside the body. That's, I think, the hardest part for people is if you're walking around with your shoulders up by your neck because you're so stressed out all the time, at some point somebody's going to be like, you look really stressed out. Why are you doing that? Can you like chill out? Like, you need to, rest down a little bit. But nobody's going to be able to tell you that in your pelvic floor, because nobody's seeing it, right? There's no way for you to even know what that you were doing it unless somebody told you, hey, have you ever paid attention to what you do with your body?
So that's good. So I'm really big on pay attention to your body. Just, I mean, I'm bad at it, but I think that if we do just little ways, because I know, I mean, my shoulders are like concrete.
Mm-hmm. Yeah.
And I just have to I've started doing these things and like right here, and I'm pointing to that, whatever the tendon is that's on the front side of your shoulder.
Yeah, your pec.
Is your armpit. What's that armpit thing right there?
Well, so in your axilla, you have your pecs that sit right up here that can stay really tight. Also, could be your bicep muscle that attaches right there. Yeah.
So I've started paying attention. I'm like, oh my gosh, I can barely just open up like that. Because when Candice and I talked about it, I was like, oh, where do I carry mine? So that's why I wanted to find out, because I think there are some ways that we can at least go, well, I can kind of feel that I'm carrying stress in this area or not. And then maybe if there is that follow-up pain in addition to, maybe that's a good conversation to have with a doctor.
Yeah, absolutely. So yeah, painful intercourse. Another common thing that occurs with that is urinary urgency and frequency. People who are going to the bathroom all the time and don't necessarily have an overactive bladder, or don't necessarily have, and they're not drinking 150 ounces of water a day. It's not normal to be going more than, really, the norm is 8 times in a day. If you're having that, you can't hold your urine more than 5 minutes and you're hustling to the bathroom, even though you just went 30 minutes ago, that's not normal. And a lot of times when I hear that, I'm thinking, okay, well, what are your pelvic floor muscles doing? Why are they giving you this kind of false sense of urgency? So there's just so many things that can cascade. It's not just pain. Like I said, bowel, bladder, and sexual function are all so correlated to pelvic floor and what it's doing. So, and that's what I love to treat.
And tell me real quick too about, you said men can have this too. Like how might that display itself, I guess, is that there are exhibit symptoms in a guy?
Yeah, absolutely. And unfortunately, patient populations of men are even smaller. And I don't know, again, if it's that they're even less likely to talk about their symptoms or that they're less likely to be sent to physical therapy. I'm not sure. But they may have, the biggest things that I see are, yes, men with pelvic pain. So they may have just pain in their pelvis all the time. A lot of times they'll describe, pain in the testicular area, maybe pain in the penis. Maybe they have pain just near their tailbone. So it can be any of that. So that's really men having pain in their pelvis. That's kind of the biggest things that I hear. They may also have, I see a lot of men after prostatectomy who have leaking of urine after they have their prostate removed for cancer, or men who have larger prostate than normal and earlier maybe than they should, that now they're having their own urinary dysfunctions. And then they can also have the same, bowel dysfunction as well, as far as like constipation or fecal incontinence. So,
so there's treatment for that, right?
Mm-hmm. Yep. And I treat all of those things and love treating all of those things. And then I also treat kids. So now I don't do any internal on children, but I see kiddos who are constipated or kiddos who wet the bed maybe way too late. Maybe they're still wetting the bed at 8, 9, 10 years old, or, whatever. They have some urinary incontinence. I have some kiddos who leak during the day and they aren't sure why. So there's just all kinds of stuff that we can do. And there's all kinds of symptoms that we see that we can help with.
Wow. Okay. And forgive my ignorance.
It's okay.
And let's see I don't know if this is even possible. Tell me, because when you're talking about the pelvic floor, and earlier y'all were both referring to like the hammock that holds everything. Mm-hmm. So how do you know where that is, male or female?
Yeah. So where the muscles sit, so you have really technically 3, but I kind of divided into 2 just for ease of explanation. Layers of pelvic muscles. So you have some superficial muscles that are mostly sphincters. And that's like, so if you think about anal sphincter, right, that you hold whenever you are in a meeting and can't pass gas, right? And then you have some muscles also more anteriorly that sit, so for women, of course, around vulva and vaginal opening, and in men sit just to the side of penis and scrotum. So those are your more superficial muscles, again, that you would want to hold like whenever you have to pee. You are in the car, you're on your way home. Those are the ones, part of it that's squeezing. So some of the sphincter level. And then you have that deeper hammock layer. And when you think about pelvic floor muscle, that's the big layer everybody thinks of. So it's this little hammock. It runs from your tailbone up to your pubic bone. And it just holds, and its main job is support of your organs inside your body. And if you want to know where it is, it's because it is a little bit deeper, but if you want to feel it on yourself, one of the things that I often have people do is, where your sit bone is down at the bottom of your butt, like when you're sitting, that's where your pressure is, that little bone. You can put your hand just right next to that, and you can try to do a squeeze or a release, and you can see if you feel anything happening. That's one way that you can kind of palpate it. It's a little hard to explain without showing.
Yeah. No, that makes sense. I see, I just would have thought it was around the hip area.
Mm-hmm, yeah.
Like everything was higher up. That's why I was like, can we explore that just a little bit, just to even know where we need to worry about where we're feeling tension. But now you explaining that, it makes so much sense to think about the different symptoms that could go on, even in kids.
Yeah. I mean, it's huge. And my biggest thing and why I love treating the pelvis is because when you break down the body, the pelvis is really the keystone of the whole thing. Right? Your upper body and your lower body both come in and attach to the pelvis, right? It happens through the spine and through its connection to the pelvis. And so
didn't know that. Thank you.
Yeah. So when you think about your body and how it functions, and some of the most important functions that we do, which is evacuation of waste, right? Bowel and bladder, and then being able to have sex, reproduction, that's vital. And that all happens in our pelvis. And it's also vital for how our body functions together. And the fact that we just don't talk about it enough is just kind of heartbreaking.
It is heartbreaking because I was just getting ready to say, I'm lamenting over this a lot because I didn't, you sit around with your girlfriends when you're over 40, ha, ha, ha. I sometimes can't wait to go pee. And, I had that same symptom. Like, I use the bathroom way more than I should. Did I ever in my wildest dreams connect that with the painful sex that I'd been having for 10 years? No. But they're so connected. And so, it is heartbreaking to know that there's all these things that are connected in our pelvis. And that's why I'm so glad we're having this conversation.
I am too. I'm glad you called me. And I'm so glad. Kat, thank you for being here too, because I think it helps so much to tie in and hear Candice's real story of, I know nothing about this. Here's what I went through. I was miserable for 10 years in this department. And here's what was happening. And here's what I went through. And then, I meet Kat, and here's what she does. And medically, physically, and then you can help us better understand our bodies because, I don't know if we all take it for granted, but unless we're in medical school or trained for any kind of health, anything, we don't know. Maybe it's just me, but I would never have thought of the pelvic area being the cornerstone of the body. But you describing that, it was like this bell went off in my head, and I was like, oh, that makes so much sense.
Right. Yeah. And unfortunately, I mean, I feel like whenever I was even in PT school and I went to the University of Kentucky, which is a great program and a great school, what I knew and what I learned about pelvis and pelvic floor dysfunction was all wrapped up into basically 1 2-hour lecture. And they, of course, the gross anatomy lab, we learned about the pelvis and the muscles, but to put it all together wasn't done until I came to Texas and did my residency in pelvic health, because there's just so much information about it that you just, and I feel like a lot of physicians say the same thing. I used to see patients in Chicago that's where I used to live, who were actual OB-GYNs and would ask me questions about pelvic floor muscle and some of the things that I'm treating, that I'm like, unless you have really trained into this, and of course, like they know a ton about what they treat, right? But then I know a lot of things about what I do and what I'm treating. And so I think it's just so important. And then we as women, we just have so much shame also tied to particularly pain with sex and having sex at all, right? I mean, that's a whole another conversation I think that we can have about us and our sexuality and our journey. But it's sad that it takes people so long, 10 years, to get into my door and into my room. Unfortunately, that's the most common story that I hear. And I am, relatively young. And so I'm excited, and I'm incredibly hopeful that throughout the course of my career that I see that change, that's the rare story that I hear, that, oh, I've had these symptoms for 10 years and I just now came to you, versus I've had these symptoms since I just started having sex after I got married 6 months ago, and I told my doctor and she sent me immediately to you. Awesome. That's my hope. Like that.
Yes, that's a good one.
And so that's part of why I was also so excited and so grateful to the both of you to be able to be on here and talk about this, because I want that to start becoming the norm. And I think the more we can talk about it and the more we can share our stories, and Candice, like, so brave to share your story.
Yes.
Because of what we just talked about, like, that's so brave. And to be able to then be willing to open yourself up like that, to then be able to help other people, that's, I think, the most important thing that we can do.
Well, and thank you, Kat, for that being your desire to help women, and especially in this way, in this area. And I love it. You seem so approachable and so genuine and so, okay, no big deal. I mean, it is a big deal. But nobody is all of the intimate stuff. You're doing what you're trained to do, and people walk in and they don't have to feel embarrassed. It's just, okay, this is something we've got to do and address, and here's how we do it. And very practical. I'm all about let's be practical and help each other.
Exactly. Yeah, absolutely.
So, and just so the listeners know, I will have information and links. So whatever you want me to be able to put with the show notes where people could get in touch with you, or even a resource maybe online that you would refer them just to go get some more information, if they maybe even, and you may already have this, like if they're listening and they go, I need to talk to my doctor about this. Is there anything that somebody could go sit with their doctor and say, here's what I heard, here are the symptoms, or a website or something, just to kind of go, I think I need to go see somebody like Kat?
Yeah, so there's a few different things. So there are definitely resources on the internet that I will be happy to send to you, and so you can post them on the notes.
Great.
And then I also can post, there's a couple of different websites that have the listing for pelvic floor PTs all across the country where our information is. So if, I'm in the Dallas-Fort Worth area, but if you're somewhere else, then you can look up and see who in your area is doing it, where are they located, and can they help you?
That's great.
Yeah. And then of course, like, as far as, there's just all kinds of stuff. So I'll give you a couple of things. So as far as like, here's some symptoms, here's some common things that we treat, and then go talk to your doctor and be like, I heard this thing. Have you ever heard of pelvic floor physical therapy? And do you think I'm appropriate for that? And
I'm big on, we have to advocate for ourselves.
Absolutely.
We have to be brave, because that's one of the things I write about in my infertility stuff is, even if you need to take somebody with you, to be brave, just do it. Be brave, ask questions. It's your right, not, to just go in and go, hey. Okay.
So I will say my insurance covers a lot of my physical therapy. And so I don't know about everyone's insurance, but it's just like any other physical therapy for your hip, your knee, whatever injury, surgery you've had, your insurance also covers this. So
that's good for people to look into to see if they do have that. I wouldn't have thought about that. So thank you. Okay, as we wrap up, here's what I want to ask you both, and whatever comes to your mind, what is the one thing you want someone listening to know? Whatever the first thing is that popped in your head, that's what I want you to share.
Do you want me? Can I
go ahead? Sure.
Start, Candice?
Yeah, go ahead.
Perfect. So what I want people to know is that they are not alone in what they're experiencing. So if you are a person who's out there and feels like this is something that you've dealt with, or any of this has connected with you, first and most importantly is you're not alone. And secondly, and also important, is that there are people who want to help you, who are trained to help you, and that are ready to help you. And so don't be scared and don't be ashamed, which is easier said than done. We all feel it. Even though I talk about this all day, it's really hard for me to talk about those things of myself, right? But don't be afraid to seek help, because we can help you.
That's awesome. Thank you. Yeah. Okay, Candice.
This is why I love Kat so much, because she just stole my idea. She just grabbed it out of my brain.
Say the same thing in your own way. There you go.
So the first thing when you said, okay, alone, was the first word that popped in my head, because it can feel so isolating when you're in pain in some place that is so intimate. And, I thankfully have an understanding husband. And so we talked about it for all these years. But also all the doctors that I saw that said nothing was wrong down there, and there really was something wrong down there, don't let that get to your head. Because if you have pain, it is real. And there is help for it. There is treatment. So if that means you need to advocate, like you said, Julie, for yourself, and say, listen, I know about this therapy. I feel that I need to be recommended to do this. Or I don't even know. Call and just get help anyway. Again, that takes courage. But instead of just remaining in pain for 10 years like me, I hope that someone can get the help they need a lot sooner. So you're not alone.
I love that. Thank you both for sharing the same idea in different ways. Because see, you had a whole different way to share that. So I just want to say thank you both. Thank you, Kat, for the work you do.
Thank you, Kat.
And we'll talk and figure out another time, and we'll do one on trauma, because we have a lot to talk about that. Mm-hmm. And Candice, my friend, I love you, and I thank you for reaching out. What a great topic. I didn't even realize we needed to talk about, and we do, and we did. And so I will have things posted in the show notes, and then also on the posts that we do, we'll provide links. So thank you both. Appreciate you. Thanks for being here today. And y'all, thanks for listening. Thanks for listening to The Bearing Life. I hope this episode helps you know you are not alone. I invite you to follow me on Instagram at Dr. Julie Shannon, where I share more encouragement for your daily life and how we can take defining steps through life storms. Until next time, take a breath and take that next defining step.